Welcome to this edition of the First Aid Show. In this edition, we're going to continue our series on catastrophic bleeding, and we're going to look at tourniquets and where to use them. Tourniquets can only be used on an arm or a leg. As with other parts of the body, you'd have to use direct pressure and hemostatic dressings. They're used to control excessive bleeding that you cannot control with direct pressure and pressure dressings. These types of bleeds are classified as catastrophic bleeds, and they include amputations, stab wounds, gunshot wounds and other serious injuries. A person can lose potentially fatal amounts of blood when they lose around 40% of their blood, as the body can no longer compensate for blood loss by increasing the heart rate or dilating the blood vessels. You can lose 40% of your blood in just 3 to 4 minutes with a femoral artery bleed. In other parts of the body, this will be more. But this shows that we must stop blood loss as fast as possible, and we do not have a lot of time to think. When bleeding is very severe, and if the person needs CPR, there's little point in delivering chest compressions if the blood is all forced out of the wound, so we can add a C to the Dr. ABC. In this example, the C stands for catastrophic bleeding, and it needs to be stopped before we commence CPR. Time is crucial, and we need to apply a tourniquet quickly, so that we can treat other life-threatening conditions like cardiac arrest. When we apply a tourniquet, the aim is to block the arteries and the veins. The arteries are found deeper in the limb and the veins nearer the surface, so we need to apply the tourniquet tight enough to block the deeper arteries and not just the veins. Applying a tourniquet too loose would be life-threatening for the patient. When you apply a tourniquet, it will be painful for the patient and it will be hard for you physically and emotionally, but it's vital it's done quickly. The tourniquet needs to be applied direct to the skin ideally, although it can be applied over clothing. But make sure there are no injuries above the application site which could be hidden by the clothing. Tourniquets are ideally applied to the single bone like the upper arm or the thigh bone, because if you apply them to the lower arm or the lower leg, the arteries may not be stopped as they're protected by the bone. Apply the tourniquet at least 5 centimeters above the joint of the knee or the elbow to avoid damaging the joint when it's tightened. Tourniquets can be applied to yourself one-handed if you need to, and this has been done very effectively in military settings across the world. Tourniquets are only removed in a hospital by a doctor and never by the first aider, even if the patient complains about the pain of the tourniquet. This pain should reduce as the area goes numb.